Hi, I'm Dr. Aruna, holistic psychiatrist and founder of Trinergy Health. I am recording this video for zerospike.org to share my experience of using augmented NAC in my patients in whom I suspect spikeopathy. Spikeopathy is this broad category of conditions, diseases that I suspect and others suspect as secondary to the persistence of COVID spike protein. Now, there are actually three ways that a person can develop spikeopathy. The two more common ways are one from any of the COVID vaccines. You could get one dose, two doses, or you may have received the boosters. But even with one or two doses, I am definitely seeing persistence of spike protein that is contributing to pathology. The second way is from persistent COVID infection, also known as long haul COVID infection. Now, the third one, there are reports of it. I have not personally verified this, is from shedding from vaccinated individuals, from being affected by shedding from vaccinated individuals. Now, whenever a patient comes with new onset symptoms or something, or a flare up since 2021, as part of my baseline assessment panel, I do check for spike protein antibodies. I recommend that patients use the lab Armin Labs. It's a German company that has centers even in the US. This company tests for spike protein antibodies. If your level is about 3000 IUs per ml, then you should get treated for it. I have seen a wide variety of results on this. One patient had around 5,000. Usually it's between 5 to 10,000 IUs. But I recently have a patient whose antibody levels were 384,000 per ml, very, very severe, and she was very ill. The second thing that Armin Labs does is that they look for cell mediated immunity. And the logic behind this is that if it is a persistence of spike protein from long haul COVID or from a natural COVID infection, then the body responds by making antibodies as well as having cell mediated immunity. So if you're having antibodies as well as cellular immunity with T cells, then it indicates that your spike protein is most likely from a natural infection. But if you're having elevated antibodies and very little or absence of cell mediated immunity, then most likely your spike protein that is persisting is coming from the vaccine, either from the first two doses or even a single dose, or from the boosters that you're having. Now, spike protein is an extremely toxic molecule that causes endothelial damage that has been shown to suppress tumor suppressor gene. It has been shown to trigger autoimmunity. It has been shown to cause oxidative damage as well as mitochondrial damage, resulting in chronic fatigue syndrome. The common syndromes that I have seen in my practice is actually psychosis, different kinds of psychiatric illnesses. I've seen OCD, I've seen new onset psychosis, I've seen new onset bipolar disorder. I've also seen new and sudden onset of cognitive decline and personality change, looking like Parkinsonism. I've also seen flare up of autoimmunity in a patient whose autoimmune condition was very much in remission, and after the vaccine, within 2 months, there was a significant and noticeable flare up that required more treatment. I've also seen I think this is the broad range of categories that I've seen. But in general, I've seen MCAS, mast cell activation syndrome. I've seen POTS, postural orthostatic tachycardia syndrome. And the same patient there's one patient who's very, very ill. She actually, the first thing that showed up was fibroids. Obviously, I've seen menstrual irregularities following the vaccine. But in this particular patient, she developed very, very huge fibroids for which she was recommended total hysterectomy. And she suddenly launched into surgical menopause and struggled with anxiety, weight gain, depression, insomnia. And then in the 6 months after this, after the surgery, she was diagnosed with mast cell activation syndrome, postural orthostatic tachycardia syndrome, Ehlers-Danlos syndrome. It's almost as if her whole body was giving up on her. But the good news is that in 3 months' time, she is 70 to 80% better. These are some of the syndromes that I've seen. I've also had in the patient that whose autoimmunity flared up, he also developed elevated prostate-specific antigen. It had gone up almost to 6. He underwent a prostate biopsy, which thankfully did not come back as cancerous. And at that point in time, when he came back, when he was diagnosed with elevated PSA, he reached out to me. I put him on augmented NAC, and 3 months later, his PSA came down to 3. The patient with sudden onset of personality change, cognitive decline, and Parkinsonism like picture, he treated him also with augmented NAC along with Ayurvedic medicine, Ayurvedic inputs, and I'm happy to say that his cognitive function, as measured by the cognitive quotient scale available on Dr. Dale Bredeson's website, he showed consistent improvement in his cognitive function, as well as in his overall regaining of his original personality, improvement in apathy, depression, Parkinsonism, everything got better. And then in this particular patient with MCAS, EDS, POTS, she has had a remarkable recovery. Now, my approach to spikeopathy is actually in this format. The first thing that I do is I use Ayurvedic inputs to restore digestive fire as well as metabolism, because according to Ayurveda, we have to restore the digestive system first, because all metabolism, even detoxification of toxins, requires a hearty metabolism. And when I talk about metabolism, I'm not just talking about digestion, I'm talking about intracellular metabolism, metabolic processes within the mitochondria, and within other structures inside the cell, including the protein manufacturing units, the ribosomes. So, metabolism implies all of this according to Ayurveda, and it is very, very necessary to restore metabolism in every organ, every cell in the body. So, for this, the typical inputs are changing the diet according to the person's dosha constitution, the energetic constitution, and then using Ayurvedic herbs as well as Ayurvedic body therapies. I vouch by Abhyanga. Abhyanga is Ayurvedic self massage with specific herbal oils that are tailored to a person's doshic imbalances. The herbs in these herbal oils directly balance the doshic imbalance, the energetic imbalance, and the technique of self massage itself has immense therapeutic effect, especially with regard to nervous system regulation. And nervous system regulation is extremely important for both MCAS as well as POTS, because we need to bring back the sense of safety, the experience of feeling safe once again within the body. MCAS, POTS, mitochondrial dysfunction, they're all a core component of all of these conditions is this lack of safety on the inside. And a really simple way of restoring that is with Abhyanga self massage with the customized specific oils. So that's a big one. That's a really big intervention in my approach. And of course, restoring hepatic metabolism, renal or kidney. So liver, kidneys, bowel function, and making sure that skin is able to sweat. Because once you take augmented NAC, it breaks down the spike protein, and the broken down components of the spike protein themselves can be toxic and further exacerbate the reaction. I do see this in the form of worsening symptoms in the beginning. But by addressing the metabolic pathways, the detoxification and excretory pathways, my patients have a minimal detox reaction. And then augmented NAC really helps to get rid of the spike protein from the body. And make no mistake, spike protein is extremely toxic. It is a foreign protein. And when you receive mRNA vaccines, your cells are being instructed to make a toxic protein that should never be inside our body. Spike protein causes endothelial damage everywhere in the body. It has been shown to flare up autoimmunity. It has been shown to suppress tumor suppressor genes, which means that people can develop all kinds of cancers. And the term turbo cancer has been used for the kind of cancers we are seeing, because people go from nothing to stage 4 very, very rapidly. I think in the history of medicine, we have not seen such rapid progression of cancers before the spike protein. And it can also cause oxidative damage, inflammation, and mitochondrial damage. And different people can develop different set of symptoms. For some, and it all depends on where the spike protein is causing this localized damage. So I've seen people develop mostly neuropsychiatric syndromes. That's, like I mentioned, psychosis, OCD, bipolar. Patients have, some of my patients have presented with neuropsychiatric syndromes, some with immune dysfunction, autoimmunity, and MCAS, mast cell activation syndromes. Others have presented with circulatory syndromes like the POTS. Others have presented with hormonal issues, menstrual irregularities, weight gain, and some have presented with a combination of all of these. But the good news is that healing is possible. Definitely with Ayurveda, and Augmented NAC has proven to be a core component of what I do for patients with spikeopathy. But the most important thing is working with your spirit. This is a spiritual warfare. There's no other way for me to describe this. The whole pandemic, it's not a pandemic, it was a pandemic, and the introduction of spike protein into the human genome has been orchestrated. It was a planned event, planned exercise, and I believe that the way to overcome this assault on humanity is through spirituality. So anyone that is experiencing spikeopathy, please reconnect with your true nature. I teach this in my practice and with my patients. Connect with your soul, with your spirit, the unified field, universe, God, goddess, however you see this. We are all made up of this same unified field. We are like fish in water. We are surrounded by the unified field, which is the God principle. It animates us, it lives inside of us. Our soul is a reflection of this unified field. Connect with your soul and give up fear and instruct yourselves to kick out the mRNA fragments. Instruct yourselves to stop making spike protein. And you can do this. Go into a meditative state. Focus on your breathing, close your eyes, spine straight. Connect with your heart. Breathe into your heart. And once you find this calmness within, talk to yourselves. They're always listening to you. Talk to yourselves. First, express your gratitude, because your cells, your body has been on your side. It has been your ally. Despite this assault on humanity, despite this assault on your body, it has still stood by your side, done its best. So express your gratitude. Then your sincere apology for introducing this harmful genetic information and the protein into your body. Then have compassion for yourself. Extend that grace, because you did not know better. It was your choice, it was your decision. Maybe it was coerced onto you. Maybe not. You did not know better. And when you made that choice, it was with the best of intentions. You did not intend to harm yourself or anybody else with this choice. So extend that grace and compassion to yourself. And then instruct your cells to stop making spike protein and to kick that mRNA fragment out in the form of vesicles and get rid of it out of your body. Shed it out. Imagine that your cells are actually doing it. And end with gratitude once again. It is possible to heal, and this is the way.